Well, with that, we are reaching out right now to Dr. Alexander Wong to talk about the latest developments. He's an infectious diseases specialist who joins us right now in Regina. Dr. Wong, I always appreciate your time. Thank you for joining us today.
Thanks, Michael. Glad to be back with you.
Listen, let's begin in your province, Saskatchewan, because the Premier, Scott Moe, is signaling an end to all COVID restrictions soon, and that does include as well the vaccine passport. And you've expressed concerns about that policy direction. Why?
Well, it's been an interesting and at times challenging couple weeks here for healthcare workers and others in the province. I think there is this ongoing tension that exists between public health as well as the political policy, and you know what, we get it. I mean, I'm not naive any longer to realize that there aren't many factors at play here when policy decisions are being considered, and we realize that, again, like, ongoing mandates are not sustainable forever. I think the challenge was really timing. We're still right in the midst of our Omicron surge right now. We're praying that we're going to see a peak relatively soon, but hospitalizations and ICU admissions are surging. We're at the highest numbers that we've seen basically throughout the course of the pandemic. And the other thing that was challenging was the fact that the Premier made some comments with regards to vaccines not preventing transmission or preventing infection with Omicron, which frankly is not correct. And, vaccines really are a sustainable way out of this. And so pushing back with some of that, again, has also taken a lot of time and energy and also been challenging. We need to really kind of focus on boosters and vaccines, as Dr. Tam mentions, as our sustainable way to ensure that we don't get crushed again and again on the healthcare side with future waves.
Yeah, but at this point, nearly 82% of people in Saskatchewan are double vaxxed, and that's ages 5 and up, and nearly 41% have received a third dose. So, I think part of the argument being made in terms of relaxing restrictions right now is what more can really be expected. You have a majority of people in the province right now being vaccinated, and despite this Omicron wave, what more can really be done on that front?
Again, totally get it, Michael. I think the big thing that, again, I'm not certain has been communicated effectively, because there's just been so much back and forth, and confusing messaging on many fronts, is the fact that getting that third dose just makes such a massive difference with Omicron, both in terms of infection. You're going from probably like 10-15% with 2 doses protection versus Omicron infection to going to 60 to 70%. And again, we really need to push that booster rate up high. We've done pretty well with that, but again, rates have slowed, and when people know that mandates are coming to an end, I think that takes some of the incentive away, to kind of get that second, third dose and so forth. But again, we understand that these types of mandates and measures and so forth are not sustainable forever. We need to find sustainable ways to move forward safe and responsibly, and a huge part of that is vaccines, and a huge part of that is messaging how to do this safely with things like masking, upgrading ventilation, and so forth. I feel like that's what we need to message going forward here.
Okay, let me break that up a little bit and first begin with, you talked about boosters, because, to paraphrase the Saskatchewan Premier, he said that those who are already vaccinated or are willing to get vaccinated already are, and those who remain to hold out are unlikely to get the shot. So what are you looking for here right now? To get the vaccination 1 and 2 up, or are you looking at getting more boosters out there?
It really is. It's really all of those things, Michael, right? Again, we know that the cumulative benefit of getting, multiple doses of vaccine, at least mRNA vaccine, it's just there. The science is there. And again, we don't look just at prevention of infection with Omicron, but we also look at the extraordinary protection that 3 doses provides you against severe illness, hospitalization, and deaths. That's well over 95%. That type of approach is what's going to keep, again, our hospitals and ICUs from getting overwhelmed again and again. So it really is that cumulative vaccine push, whether it's the first dose, second dose, third dose, and in some cases, 4th doses for eligible individuals who, for example, are in long-term care settings or who are immunocompromised. So again, some of the messaging this week from the Premier, I get the mandate thing. We understand the politics. I just wish that he hadn't dunked on vaccines as well. And that makes it really hard, I think, for us on the medical and on the public health side to convince our citizenry of how important vaccines are.
Okay, let's talk a little bit about the path forward right now, though, because you referenced Dr. Tam there, and learning to live with COVID is something that we're hearing not only from Dr. Tam, but from many health officials in this country. But regarding Dr. Tam, here's what she said, quote, "What we need to do going forward as we emerge out of this Omicron wave is recognize this virus is not going to disappear. We need to be able to address the ongoing presence of the SARS-CoV-2 virus in a more sustainable way." Again, that is Dr. Tam. So if that is what we're hearing from this country's top doctor, how would you adopt what she's talking about to the Saskatchewan experience?
Like I said, I think, Michael, the issue here is less about, the fact that we realize that, again, the vast majority of the public and the citizenry have basically done everything they can and done the right things. They've gotten fully vaccinated. They've been boosted. They've, done everything they possibly could to prevent, infection and protect themselves, their loved ones, and most importantly, everyone in society who's medically vulnerable, kids under 5, the frail, the elderly, et cetera, et cetera. That's what we're focusing on here. So again, it was really mostly about timing. We realize when we see most of the developed world is moving away from these types of measures and mandates, once Omicron concludes. So for us here in Saskatchewan, it's less about sort of, the fact that that's going to happen. We realize that that's going to happen for better or worse. But again, just give us, it would have been nice to have had a few extra weeks so that we could have clearly seen our case peak and our hospitalizations and ICUs peaks so that we knew that we were on the downswing before all of this. Again, like taking all these measures away right now or in the next week or two, in the worst case scenario for healthcare workers and our system, is just going to create like ongoing strain, which is going to be difficult, not impossible, but it's going to be a difficult few weeks for healthcare workers and our healthcare system in this province.
Alex, as I say, always good to have you on the program. Thank you for this. Appreciate your thoughts.
Always appreciate the time, Michael. Take care.
You too. That is Dr. Alexander Wong, infectious diseases specialist in Regina.